It makes me feel sad, it makes me feel frustrated.
Reaction is rolling in after leaked internal documents from Island Health say a plan to open overdose prevention sites at 3 Vancouver Island hospitals was halted by the province. The internal planning documents, first reported by Filter magazine, detail plans to open OPCs at the Royal Jubilee Hospital, Nanaimo Regional General Hospital, and Campbell River General Hospital, with anticipated rollout this year. The documents, now obtained by Czech News, show plans started in September 2023 following a directive to move forward from the health authority's president and CEO. But according to the documents, all work came to a stop in April 2024 based on government direction. At the same time, it announced a zero-tolerance drug policy in hospitals, bringing concern to a group of island doctors.
I would say very frustrating. As someone working on the front lines, it's hard to be faced with more bureaucratic red tape. When people are dying at such a high rate, it's preventable.
Roden says an overdose prevention site creates a safe space for those who use drugs, with peer workers on hand to provide care and respond to health emergencies. Adding the sites make it safer for those needing to use while receiving treatment, as well as healthcare workers in the hospitals, which is why the group Doctors for Safer Drug Policy opened pop-up OPCs in Nanaimo and Victoria 2 weeks ago.
We're all tired of seeing people die. And I know that there are multiple different solutions to this very complex problem, and this is just one of those solutions, and it's a pretty low-hanging fruit, so that's why we want to see something like this happen so quickly.
Island Health would not comment on the leaked documents, instead directed questions to the Ministry of Health. A ministry spokesperson told Czech News the province is currently taking action to establish minimum service standard for overdose prevention sites, adding it's focusing on continuing to expand addiction treatment services like detox and aftercare. But Roden says doctors are looking for action now.
We already have guidelines about how to run them through the BC CDC as well as BCCSU. So this is not difficult. We want these plans to happen yesterday. We want it to happen right away. We don't want to be waiting any longer.
She hopes the province will look at bringing back these plans to keep both patients and healthcare workers safe and alive.